medications that lower my ketones. I'm sure a lot of people, when they hear that, might be like, wait, there are medications that can actually lower my ketones? Walk us through this.
You can't just stop your medicines. It's very, very dangerous, extremely risky, and potentially life-threatening depending on the medicine and depending on how fast you try to lower it or stop it. It could be risky or dangerous. We've put together a hub of information to kind of walk people through some of these considerations so that you can think through how you might talk to your prescriber about this and how you might approach the situation. Because it is true that medications can lower ketone levels. It is also true that medications, you can start to become more sensitive to them as you start a ketogenic diet. They may need to be lowered. It is also true you might feel better on less medication. So the question is, how do you think through that and what's the next step? And so one of the things to think about is, how many medicines are you taking? How high are the doses? If the person that you're working with to prescribe them, are they open to you exploring reducing the dose a little bit very carefully under their supervision to see if you could maybe feel better with less? Unless the medicines are starting to feel too strong, I would give it at least 3 months before you start to talk about with your prescriber whether you can go down a little bit on these medicines and see how you feel. The next step is, once you're fat adapted and you're feeling better, then really a wonderful thing to explore is, can you now reduce that medication? And if so, how exactly do you go about that?